and we are joined by Commissioner Shea, Trevelyan, Commissioner Gomez remotely, and Commissioner Howard. And we'll go ahead and call the meeting to order, and I'll pass it over to the mayor to do the same.
Judge and Commissioners Court, again, thank you for letting us participate with you. I'm going to call to order the joint meeting of the Austin City Council here on October 26, 2021. The time is 9:08, we may be just shy of a quorum, but since we're not taking votes yet at this point, taking any action, we're ready to proceed.
Thank you, Mayor. All right, so never clear if we're supposed to keep calling things to order or not, but it says I'm supposed to also say that I'm calling the joint meeting of the Travis County Commissioners Court and the Austin City Council to order. We're definitely called to order by now. We're going to take up item 1 to receive briefings on COVID-19 related matters, and I will turn it over to Dr. Walks and Austin Public Health.
Thank you, Judge. Good morning to everyone in the court and City Council. If I could see the first slide, please.
And by the way, Judge, we have a quorum now.
Oh, thank you.
I'll go ahead and share my screen. Does someone have the slides available, or should I go ahead and share my screen?
This is the AV Tech and Chambers. I have a presentation, but I was under the impression that I was just hosting for the mayor and chambers.
Okay.
I'm happy to do that if someone can hand off the presentation privileges to me.
Okay.
There's no privileges. You would just have to be in the meeting to share them.
Okay, I can do that. Can you see my screen?
Yes.
Yes.
Okay, good. Mhm. Sorry, I wasn't prepared to do this, and I am having some difficulty getting this open.
Dr. Walks, this is Chuck Brotherton. I'm happy to share my screen and show your slides if that works for you.
That would be great. Thank you, because I'm pushing the wrong button. Let me take that down. Stop sharing. Thank you.
You're welcome.
You can go to the next slide, please. First of all, I'd like to thank the APH team, all of our area healthcare providers, and this community for working so hard to reduce our numbers. We currently have 269 cases that have been reported to APH as of yesterday. Our percent positivity rate's down to 4.6. Our 7-day moving average for hospitalizations is at 15. We had 145 patients in hospital, 65 in ICU, 43 on ventilators, 11 admissions, and 10 discharges. And this is all due to the efforts of this community and all of the participants in this response. In our first surge, when we had no vaccine available, we used social distancing and masking and other non-pharmaceutical measures to bring our numbers down. Second surge, same thing, only we had the additional benefit of vaccines that were given to the community. With this latest surge, we see a combination of our non-pharmaceutical measures that have helped to curb the spread, as well as vaccines and the use of monoclonal antibody therapy. With the emergence of new variants of this virus in our second surge with the UK variant and in this last surge with the Delta variant, we see that our vaccines have held up and prevented hospitalizations and death in those who were vaccinated. And we are continuing to promote masking, social distancing, and vaccinations in our community. If you could move to the next slide, please. Our APH epidemiology team is monitoring the situation in the UK and Europe. And if you look at the two slides on the left-hand side of the screen, you're seeing the surge in cases that's occurring across the ocean. They have postulated that these increased numbers in cases are happening because of decreased masking and waning immunity and the decrease in the numbers of those who are not receiving their primary vaccine series. Next slide, please. The UT modeling group has been working with APH all along the way to help inform our risk-based guidance measures that we have been using. And the modeling shows that in the top two figures, that if we continue with the threshold for stage 2 of 5, that we may see 2 surges in the November-December timeframe. And it's postulated that that may be because of the decreased measures of masking and social distancing. If you look at the picture that's depicted on this slide, it's a picture showing what's happening in Europe and UK at this point. And the headline is saying that what's driving the rise in the UK COVID cases is thought to be the relaxation in masking and also people not going to get their booster jabs. As we know, we've just received full authorization for emergency use authorization for boosters for Janssen and Moderna, and we now have boosters recommended for all 3 of the COVID-19 vaccines. So it's important for our community to continue to get their primary series of vaccines if they've not been vaccinated, and to go and get their booster vaccines to boost the immunity that they have to COVID-19 and prevent severe illness and hospitalizations. Next slide, please. Another factor that's important to help us protect our hospital systems, which is what we've all been trying to do throughout this pandemic, is to look at what the impact of flu and influenza season will be on our hospital systems. And this slide depicts what's happening in Travis County. For the previous season of 2021, when we were masking and social distancing consistently, you see that our flu numbers were very low. We have started to receive those reports of some minor numbers of flu cases, but it's important that we as a community go out and get our flu shots and do those same measures that we've been doing to prevent developing COVID-19, which is wearing masks and social distancing, staying home when sick, and preventing and protecting illness in ourselves and our family. And our next slide, please. This slide is showing us the breakdown of the number of cases in Travis County hospitals. And at this point, 59.89% of patients admitted to hospital for COVID-19 are from Travis County, and the remainder of the counties in our surrounding area contribute to the remaining admissions for COVID-19. Almost all of those admitted to the hospital are unvaccinated, And in this slide on the right-hand side of it, you'll see our vaccine numbers of those vaccination status that are reported on patients for our hospital systems. And the next slide, please. If we look at the breakdown of the race, ethnicity, and sex of those that are contracting COVID-19 in our county, there is a disproportionately large number of Hispanic individuals and Blacks that have been contracting COVID-19, an ongoing problem that we're addressing with continued efforts and outreach into those communities. Next slide, please. What we've seen with the lifting or relaxation of masking is that children do indeed contract COVID-19 and do develop illness at times that requires hospitalization. And since the 27th of September through the 24th of October, there have been 40 admissions to the hospital of patients under the age of 18. 10 have required ICU care. None have been vaccinated. If we look at the age distribution that's been seen in the past 4 weeks, we see that there still remains a higher percentage of younger individuals admitted to hospital. The 20 to 49-year-old age range is now more represented in this Delta surge than in previous surges. If you go to the next slide, please. When we look at our school systems with masking been inconsistent in a lot of our school settings, we're seeing more spread within the classrooms, followed by spread in athletic, after-school activities, and in school transportation scenarios. We applaud those school districts that require a mask, and they've been able to help reduce the spread of COVID-19. And in this last week, we have had reported to us 181 cases, 158 of those in students, and the remainder in staff and employees. Next slide, please. Our long-term care facilities are a testament to how effective vaccinations are in that age group and in our community as a whole. We've seen a continued decline in the number of cases. Those cases that have been seen in this last 14-day period were in 5 fully vaccinated individuals. None of the cases that have been reported to APH required hospitalization. Next slide, please. When we look at reinfections, we are assessing whether after full recovery from COVID-19, 90 days after recovery from COVID-19, there is a subsequent reinfection. And during the period of the Delta surge, we saw an increase in the numbers of cases of reinfections, which is coinciding with the information that we know now that antibodies that are produced confer protection from reinfection for a 90-day period, after which time it is recommended that those who have had COVID-19 go and get their vaccination series. Next slide, please. When we look at breakthrough cases, of the 119,220 cases that have been reported of confirmed COVID-19 to APH, we've had 8,700 confirmed breakthrough cases. 90 of those patients of the 8,700 required hospitalization. 45 of those were male, 45 female. We've had 45 COVID-associated deaths since vaccines were available in late December of 2020. And that, again, is a testament to the protective effects of vaccination to COVID-19. And it stresses the need for our community to get their vaccinations. And for those who are eligible, either 2 months after their initial Janssen series or 6 months after the mRNA, Pfizer or Moderna series, those boosters are important to protect them from severe disease, death, and illness. This is a look at a huge number of patients that are collected in a system called the Cosmos system. It is 120 million patients from 700 hospitals and 10,000 clinics across 50 of our United States. And these entities are health care facilities that are using an EMR system called Epic. Of the 17 million patients that received full vaccination coverage, they report 151,570 breakthrough cases. I particularly wanted to point out that the number of breakthrough cases that occurred during the months of July and August during the Delta surge were, as shown there, 17,058 to 59,000 in August. If we look at the numbers for hospitalizations, infections, and deaths for each of the vaccines that are currently available in our country for protection against COVID-19, you see the numbers listed there. And each of our vaccines are effective at providing protection against severe disease, infection, and hospitalizations and death, with the lowest protection rates being seen with the J&J, but nonetheless, there are all protecting against infection, hospitalization, and death. And this is a slide looking at what our APH epidemiology team has been monitoring throughout the pandemic, but particularly during the year. This year, when we've been able to give vaccines to our community, and we have had 7.8% of breakthrough cases that resulted in death. I want to take a minute to point out that Texas and Travis County have experienced 3 COVID-19 surges during June of 2020 through August 2020, November 2020 through February 2021, and then July 2021 through October 2021. And in each of those successive surges, we've had approximately 228 to 267 deaths occur. It's going to be extremely important for us to, one, prevent another surge by continuing what we know works, wearing masks, social distancing, staying home when sick. If you are feeling sick, get tested, identify if you have COVID-19, stay home, protect yourself and your family and your colleagues and coworkers from spreading that to them. And if you are eligible for booster, get booster shots to improve your immune status. There's been a lot of question about our business community and our events, and I like to share this slide because it shows that our food and bar establishments have been practicing the social distancing measures that we've asked them to, and those that practice masking have less COVID cases. we have had several large events in our community. ACL, 2 weekends that went well. Our epidemiology team reports that we've had less than 40 cases of individuals who reported that they attended ACL, as well as non-festival venues. And they continue to monitor cases throughout our community to identify the impact of these events on our community's well-being. What I'm concerned about and what I leave you with is we are coming on the holiday season, and a lot of our transmission has occurred in small, intimate settings of families gathering for events and festivities. And as we go into our season of Halloween and Thanksgiving and all of the Kwanzaa and Yom Kippur and all of the things that we celebrate and traditionally, it's important that we plan and prepare to protect ourselves and our families. Mask and social distancing crowds when you're out gathering gifts and provisions for your festivals and your dinner parties. Make sure that if you have any sniffles that you identify whether it's really just allergies, get tested. If you're not vaccinated, plan to do so now so that you'll be fully vaccinated when those occasions come about. And if you're eligible for a booster, please go and get your booster shot. We have an opportunity to enjoy and relax during these next few months. And I hope that we will take the opportunity to do what we've done so well this time. Let's maintain this level of calm. Let's give our hospital staffs and clinic staffs and our APH staff a break. Let's be able to celebrate the season together safely and in a healthy way. Thank you. That's my last one.
Thank you, Dr. Wilkes. Director Stirrup.
Yes, good morning, everyone. Just gonna share my screen here. And hopefully I'm sharing. Oh, girl. All right. So thank you, Dr. Walks, for that update. I am going to share an update on some of our operational activities. And so for the month of October in review, even though we have a few days left, you can see here that we've given out 1,978 COVID vaccines in total from the 1st through the 24th of the month. And this slide just shows the breakdown of which vaccine and what type of dose we've given out. We still continue to do some testing. Our St. John sites is the most popular place for folks to come and receive a COVID test, with just a little over 2,200 shots or tests administered there, 59 through mobile testing and 924 at our Dove Springs site. As you are making your plans to enjoy our holiday season, testing is an important part of that. We continue to provide testing options at the Dove Springs Rec, St. John's. In-home testing is available by calling 311. We continue to offer facility testing, and we can also provide mobile testing, and that's where our team will come out to you and give you a COVID-19 test, and you can schedule that by calling 512-972-5560. When we look at our progress with vaccinations, week over week, Travis County is 72.5% fully vaccinated for those who are 12 and older, with, as of the 25th of this month, a total of 1,652,870 vaccines were administered in Travis County. while we're tracking folks being fully vaccinated, we know it's important to have an awareness of those who have not received their second dose. We continue to make incremental changes with this number. The last time I spoke to you, it was 110,000 residents who had not received their second dose, and that number has gone down to 105,000. So this is the data for Travis County broken out by race and ethnicity. And this is according to the Texas Department of State Health Services website. And the important things on this slide for me is, as we continue to monitor the equity gap, is that we're seeing a flattening in the Black or African American population, with us being only at 36%. The Hispanic or Latino population is at 50%. As we move into boosters, we still are going to have an intentional emphasis on making sure that we get the community fully vaccinated. And so efforts focusing on those populations will be key. There is some concern about the data on the part of our EPI team because of the large percentage of individuals that choose other. And there is an intuition that there is a misrepresentation of the uptake in the Hispanic and Black populations if folks choose other instead of that category. And so we're continuing to try to dig down into that data to really get a clear picture of what is going on in those communities.
Adrienne, your voice dropped off when you were saying that last piece about other. Could you repeat that?
I sure can. Thank you, Commissioner Howard. We believe that there may be some underrepresentation, particularly in the Hispanic and Latino rates, because of the high percentage of folks who are choosing other.
Okay.
And that doesn't match up with the census population of folks who had initially identified as other. So we're thinking when folks are registering, there's some hesitancy for whatever reason to identify their race and ethnicity clearly. And so they're choosing other. But our team is digging more down into that data so that we can have a greater picture of what our disparities gaps are. I think this next slide, the maps, help give us a better picture of where those gaps might be. For our first dose fully vaccinated, I love all of this green. It's great. Of course, we still have that one spot in the middle, and we know that's a data collection issue because of students that may have received their vaccinations in another place or state. And so we can see zip code wise, especially in those areas where we know we have higher concentrations of Hispanic or Black populations, that we're looking pretty good from this point. A first dose, I beg your pardon. This is the first dose map. When we look at the second dose or fully vaccinated population map, so this is where we still see the gaps. 617 is still below or at the 50% mark, and the team tells me this might have something to do with counties outside of Travis that are in that area code. I think the updates for this week is that 5-2 turned blue over the 60% mark, and we had 2 zip codes moving from blue to green, and those were 5-8 and 2-4 of being 70% fully vaccinated. So the progress is happening. Hats off to, of course, the APH teams doing that good work in community, and of course the work of the constable and the county collaborative. And so, again, for those who are watching, if you're planning for your holiday season, we know testing is one way to prepare, but we also know vaccines are the best way to go. So if you want that first class experience, we invite you to come out and get vaccinated at these locations. This week we'll be at our standard locations, or our static locations: Southeast Branch Library, Little Walnut Creek, and the Pflugerville Library. We'll also be at the Delco Activity Center and at Sims Elementary. Again, clients do not need ID. We are providing booster shots of any formulation at any of these locations, but you do need to have your vaccine card because it makes it easier for the staff to look up which vaccine you received and to know which dose you are eligible for. In addition to these static sites, we'll be at over 13 events this week, including the Korean Cultural Center, the Austin Transition Center, and at the Arch, the Austin Resource Center for the Homeless. So booster and pediatric emergency use authorization status. The FDA provided EUA and CDC advisory panel on immunization practices. Recommendations to approve adding Moderna and J&J boosters. Um, and so we have integrated the updated booster clinical guidelines into all of our practices. Again, you can come to any of our locations and get a booster. So for Pfizer and Moderna, boosters are recommended for the following groups: 6 months or more after their initial series. So 6 months after you receive that second shot, if you are 18 and older and live in a long-term care setting, or 18 and older and have underlying medical conditions, or 18 and older and work or live in high-risk settings, a booster shot is for you. And so if you receive the J&J vaccine, the new recommendation is 2 months after that first dose. If you fall into any of the categories that I mentioned before, a booster shot is for you, or anyone who received J&J at all. So J&J is open. A J&J booster is available for anyone who received J&J as their initial COVID vaccine. And now you can mix and match for booster shots. And so it's a lot of information to process, and our team is ready. You can either call our equity line by 311, or when you walk up for your appointment, you can have the conversation with the patient reps on hand, and they'll help you figure out which booster shot is for you. And the thing that we're all waiting for, the meeting is today for the FDA to consider the clinical trial data submitted by Pfizer for vaccines for kids 5 to 11. And as we've said, in presentations before, as soon as that approval happens, the ACIP committee will meet, Advisory Committee on Immunization Practices, and they'll issue those guidelines. And then we'll be able to incorporate those guidelines into our clinical practices and begin providing shots to our kids. And so our proactive approach for planning for COVID-19 vaccines, we will be a provider. We will begin by having vaccines at 4 established locations, and that will be Delco, Sims Elementary, Shots for Tots St. John's, and Shots for Tots Far South. We won't have any pop-up locations in this first week due to the uncertainty of vaccine delivery. Once we get into the flow and we're getting regular deliveries, and we imagine that will be the following week of the 15th, we will continue with our 4 static sites and add school pop-up clinics in areas that have limited access points. And so we're currently working with Manor ISD and charter schools in 78724, 78617, 78744, and 78752. In addition to being a provider, we plan to add provide technical support to the broader provider community. And that is anywhere from transferring small amounts of vaccines to helping providers figure out billing and reimbursement practices. We're currently having a convening of providers at the end of this week to assess community capacity and identify any needs and gaps, and make sure that providers are aware of the assistance that Austin Public Health can provide. We're also, as of last week, we distributed a parent survey to assess vaccine location and provider preferences, and to identify any hesitancies that parents might have about their kiddos getting vaccines. And I want to point out that the staff were very intentional about the picture that they chose for this slide. And you can see that mom is holding her daughter while a shot is being administered. And that's just a reminder that this is going to be a very different operation from adult vaccines. There are a lot of things that we have to take into consideration. And one of which, if a child needs to be held or comforted during the administration of a shot, that has to be a parent. And so we're really working closely with our clinical partners on the ground at schools to figure out what will be the best process to push into schools, and really working to create safe spaces and places for kids to get vaccines. It's not a one and done. They have to come back and get another shot. And this experience could very well tarnish their approach about the doctor or shots or anything like that. So we're really taking great care to make sure that we not only have the right staff, we have the right environment, we have the right process, and we have the right prizes to reward those kiddos for being brave and getting that shot. Last night, we held the first of a community engagement session to invite the community to really give some candid commentary on their experience receiving vaccines. Hats off to Cassie De Leon, our Chief Administrative Officer for Disease Prevention and Health Promotion, and her team for putting this event together, as well as the Joint Information System and CPIO. We really worked hard to make sure that there was inclusivity as with respect to language. I believe we had over 5 languages or offered interpretation in 5 languages, as well as offering ASL interpretation. And so there was a general session where we were all together, and then there were breakout rooms by language so people could feel comfortable in sharing their experience in their language of choice. And so in this first night, I think it's pretty good for a Monday night. We had 70 participants. Round 2 will happen this Saturday, early morning. And so we will continue to get that feedback from community, not only to inform the booster rollout, but to make sure that we are addressing any technical or language or geographic barriers that people are still feeling to make sure that we can get our community fully vaccinated. And this is just a slide to show our outreach efforts for the week. On the 25th, we held our CHW Career Fair, very important because we're going to need those boots on the ground teams to help give good information, especially now with all the difference. Do I need a half dose, a full dose, a J&J? And so we really want to make sure that we have teams that are ready and are connected to communities and armed with materials to make sure we're providing good information in spaces and places where people live, work, and play. We had 26 people show up on at that event, and 7 of them were potential hires, and 3 of them are already in the process of being hired. At Gus Garcia, we served 475 families with PPE and hand sanitizer. We also gave out 125 resource packets, which included shelf-stable food bags and information about immunizations, resources for food and rent and utility support. And we also gave out some children's books and cookbooks. And that makes me smile because in the midst of this pandemic, we are aware that there are some serious impacts on families as a whole, whether through loss of income and families are struggling to make ends meet, with kids having a year of virtual learning and that loss of learning and that gap that's growing wider for our kids in Black and Brown communities. And so you might think, why are books important when we're talking about COVID-19? we're talking about our community recovering as a whole and building resiliency. So supporting families with their basic needs and our kiddos with their learning is really important. And so hats off to the staff for really taking that full-fledged approach to serve communities. Over the last week, we had our Boo the Flu event where we not only gave flu shots, but we also administered some COVID-19 vaccines. We were also in 78704 at the Travis Park Apartments, the LifeWork offices in Rainbow House, and 21 at the Double RR. I don't know where that is, but we were there. In 23, we were at the Poco Loco, the Kensington Village, and the Springdale Shopping Center. In the 4-1, we were at the Green Blair Apartments at Foundation and Communities Harbor Terrace, City View at the Park Apartments, Today's Style, and the Easy Pawn Shop. In 5-2, we were at the Lone Star Family Market in around the St. John's neighborhood. In 1-7, we were at the Chevron gas station up in Del Valley. And in Maynard, we were at the Ramos Mexican restaurant and the Walmart. And so as we grow our boots on the grounds teams, we are really being intentional about being in neighborhoods and communities where we are seeing those gaps. This is a photo of the event that we held at the Dove Springs Rec, where 417 families were served with PPE, the same resource bags, and children's books again. And that is the end of my report. And this is the team out at the East Austin Neighborhood Center doing that drive-through bag distribution. So I thank you all for your time today, and I turn it back over to the judge.
Thanks, Director Stirrup. Chuck, are you on? There you are. Chuck Brotherton.
Judge, I am here. Good morning, Judge and Mayor, council members and commissioners. I'm Chuck Brotherton, Travis County Executive for Emergency Services. I'm here this morning with Constable George Morales of Travis County Precinct 4 to update y'all on our strike team, our vaccination strike team activities over the past week. You can see my screen. You can see that total doses for last week for our collaborative, 526. That was across approximately 30 separate strike team activities, which makes an average of about 17 shots per event. I think for our pop-up events, the strike team events in our supermarkets and other places, those are very good numbers. For our drive-through effort at the Travis County Expo, which we do continue on Saturdays and Sundays, those numbers are beginning to drop off rather significantly. So we are continually assessing our ongoing efforts and working to make adjustments as we ramp up our plans for vaccinating pediatrics, children ages 5 through 11, and working with our school districts. It may be that we decide to reallocate some of our resources from the expo to those school pop-ups, but that's to be determined, and we're going to continue looking at that as we move forward. Total number of vaccinations provided by the Travis County Collaborative to date. We began back in January. So up until this past weekend, we've got approximately 111,331 shots delivered. Our initial vaccinator of record was Community Care, and they were with us at Circuit of the Americas. They did about 74,000 doses. And now with Travis County ESD 11 and Fire Chief Ken Bailey as our current vaccinator of record, that vaccinator has documented about 37,500 shots. While, as you heard from Director Stirrup, as far as race goes, the other category is a high number. When you look at ethnicity, however, you can see that the Travis County Collaborative has delivered most of its shots, about 26,000, to Hispanic or Latinx patients. Moving on to the next slide, rather busy slide, but I'll zoom in on portions of this. On this previous one, you can see that our Travis County residents, 33,675 so far. The other category, people who live outside or report living outside Travis County, 3,800. You can see on these two maps in the upper quarter of this graph that in Texas and elsewhere around the U.S., those are the locations where those folks who are non-Travis County residents report living. So indicates just the number of visitors that we have and the folks that we're vaccinating. Over on the right-hand side of the upper page here, you can see our vaccine distribution by zip code. And you can see the size of the box indicates the numbers, the larger numbers of people vaccinated. So this is an illustration that we are continuing to vaccinate primarily people who live in our most underserved zip code. 78724 is where the Expo Center happens to be. 78617, 78653. All three of these are in our top underserved zip code. So moving down on this page. Again, vaccine over time in the last 30 days. You'll see yellow are first doses, red second doses, and green are boosters. The Travis County Collaborative is a Pfizer operation. So the boosters that we are providing are Pfizer boosters, third doses. As you heard Director Stirrup also say, we are able to mix among the mRNA vaccines. So if you did receive a Moderna first cycle, as I did, I got 2 Moderna shots initially. You can follow that up with a Pfizer booster, as I also did. I went to a commercial pharmacy this week, and they gave me a Pfizer shot. So, and then over on the right-hand side, you can see again over time from March through this past weekend, the numbers of first, second, and third shots. And on this last or third slide, strike team events by zip code over on the left-hand side. Again, we are serving primarily the Eastern Crescent. And you can see the numbers of shots, 78724, again, that's where Expo is, 47 separate events over time. And then over on the right-hand side, these numbers are for the past week and the zip codes that we have served and the number of shots in each of those zip codes. And at this time, I will stop sharing and turn it over to Constable George Morales.
Good morning, Commissioners, Council members, Mayor, and Judge. We continue to focus our outreach on education, doing the work to make sure our strike teams are successful. Our mobile vaccine collaborative teams gave a combined total, along with our additional partner, Texas Allied Health, was 601 shots this past 7 days. A total for the month of October is going to be 2,804 shots given. We handed out a total of 2,900 flyers, 720 phone calls. We continue to target a lot on the highly affected zip codes, which are 78758, 78724, 78741, Del Valley, Austin Connolly, 78744, and 78752. We will be currently working at our Title I schools areas this week at Mendez Middle School and Keeling Middle Schools. Also focusing with working at Del Valley Opportunity Center and Daly Middle School. This past week, we did Blue the Flu with Travis High School and handed out a lot of educational and answered some good questions out there. Also, we gave an impressive 32 shots at Austin FC. We'll continue to work at the Mexican Consulate, and we did attend the Pflugerville football game as requested by Commissioner Trevilian. Again, this week, we're focusing on ASD schools, our high zip code population, and our static locations at JD Superstores and the Poco Locos. We want to continue to press education out there so that we don't want people to drop their guard coming into these winter months, because I too took a flu shot about 2 weeks ago, and just to prepare myself and my family that we don't take anything lightly and we keep our guard up. And I'll turn it back over to Chuck.
And commissioners and council members, as I like to do, like to just show our viewers how easy it is to find vaccination information by looking at a couple, 3 websites. On the Travis County website on our landing page, it's a very easy link, 1 click away. for COVID pop-up clinic vaccine events by day. And you can see this here Tuesday, October 26th. We've got information not just for the Travis County Collaborative, also for Austin Public Health, Delco Activity Center, Austin Resource Center, Little Walnut Creek, Southeast Library, as well as where the JD stores where our strike team folks will be appearing this evening. We've also got some other folks, Williamson County, and some others who are participating and giving us their information put on this calendar. And as you go through the week, click on any one of these and you can find out all of the information, hours of operation, type of vaccine, the location, no appointment needed, of course. On the City of Austin landing page, again, for more information, one click, find coronavirus information, and then one click here to find locations for free COVID-19 vaccination. And then for retail vaccines, local pharmacies and so forth, vaccines.gov, which is available both in English and Spanish. All you need to do is to click on the location, type in a zip code, and I will type in 78617. Instead of 25 miles, we'll see what's available within 5 miles of that zip code in terms of a retail pharmacy. And you can see, again, this underscores the importance for us to continue what we're doing, which is offering vaccines by local government. One retail pharmacy within 5 miles of this underserved zip code. And that's true across the Eastern Crescent. So again, folks who are looking for vaccines, I would point them back to the Travis County webpage, City of Austin webpage to find where those shots might be available. Judge, at this time, I'll stop sharing and turn it back over to you and the mayor for questions.
Thanks, Chuck and Constable and everybody. We will start out with our questions from commissioners, then we'll go to City Council. So I'll start with Commissioner Gomez, if you have any questions.
Yes, this is really great news. I'm glad to hear. Can y'all hear me?
Yes.
Yes.
Okay, great. This is really great news that I'm hearing, and it sounds very promising. I noticed that there's still hesitancy out there, and Constable, if there's hesitancy among the adults, is there going to be hesitancy of getting their children vaccinated?
One question that was pondered this weekend, Commissioner, was parents waiting for their children, smaller children, to get vaccinated, and they would get vaccinated with them. No matter how hard we press to try to say, well, be an example, let them see you do it now. They were still holding off. So those are some hesitancies that we're seeing. We're also seeing, obviously, past a history of vaccines within the United States. We're also seeing some inequities for healthcare and services provided in the Eastern Crescent. So there's a trust issue. So we're going to continue to beat down those walls and get the information that we need to get out there.
Well, and I also wonder the role that schools could play in this by talking to elementary children about health issues, about healthy issues, about everything, eating, exercising, et cetera, including vaccines. And in order to avoid some of the COVID and flu and et cetera, to stay healthy. So I wonder, are schools, do we have health classes in elementary schools, starting in elementary? Because I think that's where it ought to start. Because you'd be amazed how enthusiastic children can be, and they'll talk to the adults about some of the things that they learn in school, about everything, and they will tell you in very enthusiastic terms, Mom, it's important that you do this or do that, and so do we have health classes in elementary schools or junior high and high school?
So, Commissioner, we have had this discussion with our ASD schools and the information. It's like when you used to get those pamphlets about smoking and you take them home and you tell your parents about smoking. Some of those issues that are out there is, again, the Mobile Vaccine Collaborative is to reinforce and support Austin Public Health and other shot locations. That has been a great discussion. And again, maybe I could refer to Adrian Stirrup on more of the education purposes on children in elementary schools.
Great.
Thank you. Commissioner Shea?
Thanks, Judge, and my usual gratitude to all of our staff who have been diligently trying to keep the community safe and educate everyone about the importance of getting the vaccine, staying masked, social distance. I noticed on one of the charts, it looked as though, and I think someone said that we are expecting another potential surge in the November-December timeframe. I'm assuming that's because people will be inside, they'll be at family gatherings. And what specific guidance can we give people to try and prevent that surge from getting out of hand like the others have?
Thank you for asking that question. We need to plan to be safe, plan to get vaccinated if you're unvaccinated prior to going to visit grandma. And if you're sick, don't go and visit grandma. And if you need a booster, or if anybody that is going to be going to visit friends and family, they should go and get that booster to make sure that they have full protection from vaccine.
And will we still be recommending that people mask or try and socially distance when they're with family members and indoors because the weather's cooler?
Indoor masking would be recommended if you're going to be in a situation where you're with a group of people who are not from your household, particularly if they're not vaccinated or if they have a medical condition that would put them at risk for COVID-19. If you're not going to do that, I would recommend that people test before they go, just to make sure they don't have a symptomatic illness.
Thank you.
Thanks. Commissioner Trevelyan?
Okay. Once again, I want to commend the team for the work that's been done. And I just want to ask a couple of questions. And one is going to be, have we given you the resources? And I guess I'll direct this one to Constable Morales. Have we given you the resources that you need to address the pop-up clinics that you have been putting together? It seems like we're getting better results from the pop-ups than we're getting from the static sites. So do you have everything that you need? That's my question for Constable Morales. And my follow-up, and this might be to Dr. Walks, is what is the opinion about getting, I've heard 2 or 3 different discussions. What is the opinion about if taking a different vaccine for your booster than you took for your first and second shots? Meaning, if I took Moderna twice, is there a benefit to taking Pfizer for the booster, or is the greatest benefit coming from taking Moderna again?
The CDC has provided guidance to allow for mixing and matching, and you can certainly do that. And I would recommend that anyone who's going to have a booster, if they are considering changing from one product to the other, that they consult with their physician to make sure that the change that they're considering making would be advisable for them and their particular medical conditions.
Thank you. Constable Morales, do you have what you need, or should we be looking for additional things?
So on the medical side, I think we're keeping up as best as we can. We do tend to run thin sometimes and try to maneuver and try to fill areas, but we're doing great on that side right now as I can speak. On my side, the outreach, we're still trying to keep up. As you know, we are very thin, and we're trying to keep up with shot locations and additional staffing. shortages that are current, not with my office, but current around Travis County. So we're going to do our best as we can. Yes, there are some difficulties along the way, but we keep up. So I guess if it's a 50-50 question there, yes, additional resources are needed, but the other 50% is we're going to keep up as best as possible.
I just want you to be able to, and we can have this discussion offline, to enumerate some of the things that are necessary so we can go about making sure that you have what you need to get the maximum number of people.
Thank you, Commissioner.
Thank you, Commissioner Howard.
Thank you very much. I wanted to know from Adrian when the provider meeting is, and if that is something that I could make sure that the jurisdictions in Western Travis County are aware of as you gear up to, offer technical assistance and information around pediatric vaccinations.
So it is scheduled for this November 5th. I was going to say this Friday, but Halloween hasn't happened yet. So it's scheduled for November 5th. Dr. Walks can speak more about the invitee list. It is limited to clinical providers because we really want to get that input. But if you have physicians that should be invited, please let us know. We've talked to IT and we've got the WebEx set up so we can host a huge crowd. So the more the merrier in terms of getting that information and feedback.
Okay, thank you.
And thank you. I wanted to go back to Commissioner Govez's question about the education in schools. That's something that we can talk to the individual districts about. There is a process where there's a committee that would have to review any materials or information, and then it would be it would have to get that approval. But let me talk to staff to see if that's something that makes that's feasible in terms of operations, and then have some initial conversations with those shacks in AISD, probably Manor and Del Valley, and to see what the process would be and if they would even be open to it. Unfortunately, the COVID vaccine brings so much more to it than a health discussion, and we would want to tread lightly, but definitely food for thought, and we'll take that back to the team.
Yeah, I just don't want to overlook young people and just assume that they don't know what's going on. They're smart.
Thanks. My question on the testing, Dr. Walks or Director Stirrup, do people have to be symptomatic to get a test, or could they go to one of the APH free testing sites or buy a test at a pharmacy just to check out if they're positive before they go have Thanksgiving dinner or things like that?
They could pick up a home test in a local pharmacy or go to their provider or go to one of the testing locations that we have.
Okay, and so it's not a requirement that you're have a runny nose or some symptom of potential COVID to get a test, right?
No, and when I mention that in particular, I'm thinking about people that may have been in a work situation where they were unmasked and they're not sure if they were exposed, or in a crowded situation where they were possibly exposed, so that they can limit that risk by checking a test.
Awesome, thank you. Mayor, I'll pass it on over to y'all.
Judge, thank you. We're going to begin with District 1 and then work our way up. So we'll begin with the Mayor Pro Tem.
Thank you, Mayor. I appreciate it. Thank you, Judge. Commissioners, my colleagues at the council. I actually don't have any questions. I want to express my deep gratitude for the continued efforts around getting our community vaccinated, getting our community tested, keeping our community informed. I continue to hear really positive experiences and outcomes from our constituents when it comes to them finding the resources that they need. I actually personally had to help somebody find some resources recently, and I was very impressed to say that it was a painless and easy to navigate experience, even for a person like me who's not entirely technologically savvy. So good job, everybody, on our continued efforts. I have more of a statement than a question, though, in that I have found that talking to folks in a way that we are maximizing our efforts and limited resources by applying those to people who are interested in being a part of the collective effort to move us forward in this continued fight against COVID-19 has proven to be the better use of resources. And that's certainly not to say, give up on anybody. We keep plugging away and keep pushing and encouraging people to participate. But I really do just want to say that I personally in my office and our efforts have been doubling down on people who are interested in moving forward together as a community to keep ourselves and our families and friends and communities safe. So that's all. Thank you, everybody.
Mayor Pro Tem, thank you. I don't think Councilmember Fuentes is with us this morning. Councilmember Renteria.
I just want to say thank to all of y'all for the outstanding work that y'all doing. And when y'all was having that discussion about others, I kind of chuckle a little bit because all my grandkids are others. Because they're either half black or half white. So whatever they would want to be, I have some that have 3 races in them. So white, Mexican, Latinos, or whatever, and then black. So it's very hard for them. It's not hard for them. They go by the Renteria, but that's what they identify by others. So thank you for bringing that up.
Thank you. Is Councilmember Cassar with us? Councilmember Kitchen is not. Councilmember Kelly?
Hi, I don't have any questions at this time, but thank you so much for all of the information that was provided. It was very, very helpful.
Thank you. Councilmember Poole? I don't know if she's with us. Councilmember Ellis?
Mayor, I certainly do appreciate all the work that's not only going into these initiatives, but also into the presentations to help us understand all of these moving parts along the way. I did have a question about underlying conditions. I see in the presentation it links to the CDC website, but I was surprised to see how many different types of conditions might qualify. So could you go into a little more detail about maybe some of the things that people wouldn't expect would be an underlying condition that actually are?
We look at hypertension, diabetes. We could be talking about people with psoriatic arthritis on particular medications, autoimmune conditions like Crohn's disease. So the list is long and comprehensive. The point really is for us to make sure that we let people know that the booster is going to help shore up their immunity and make sure that they have the full protection that they can get from being vaccinated.
Thank you.
Thank you for the question.
Yeah, I did read through it. I was surprised to see, individuals with HIV qualify as underlying condition, people on a schizophrenic spectrum qualified too. So I think it's really important for folks to try to look up that CDC website and really look at all those conditions, heart and lung issues that really can qualify and drive home the point that it's okay if you have these conditions to go ahead and sign up and get your booster because there are quite a few conditions that qualify people.
Yes, thank you.
Thanks for all your hard work.
Councilmember Tobo?
Thanks very much, all of you, for your continued efforts in all of these areas. I need to clarify the booster. So, and I'm sorry, I know you've presented this information in past weeks, and there's a lot of information out there on the website. But first of all, I also want to just step back and say how excited I am that pediatric vaccines may be just literally a day away. And thank you for all the preparation that you've done to make sure that those are going to be, as soon as the FDA gives approval, that you're poised to provide those. So that's great news. I wanted to clarify about the boosters. It's my understanding, based on your information and the information out there, that if you are not falling, some of us have passed our 6-month period, but if those in the community who have passed their period but are not in one of those high-risk groups are not eligible for a booster. Sorry to say that in a negative term, but do you have a sense of how soon boosters can be accessed by those who don't have underlying conditions but do have passed their 6-month period?
I would first of all ask people to look at that list because it is extensive, and talk to their provider because they may actually qualify for that booster and not be aware of that. And with regards to when they will expand it to all of those who have received the mRNA Pfizer and Moderna shots, that will probably be happening within the next several months, but we've not been given a time as yet. But I would really urge people to talk to their provider because they may actually qualify and not realize it, as we discussed earlier.
Even though they may not see a condition on that list?
Yeah, I would definitely have them reach out to their doctor to make sure that they don't actually qualify for a booster.
Thank you. And I think I heard you suggest that individuals who are visiting family members with underlying conditions might qualify for a booster through their association or impending visit. Did I understand that correctly? When you were talking about holiday times, I think I heard you talk about boosters in that context. So if there's an individual who doesn't have one of those underlying conditions, but is visiting with a family member who does,
then the booster may
qualify based on that association.
Right, because they're associated or living with someone who's immune compromised.
So
yes.
The answer is yes, they would qualify based on that?
They may qualify based on that, yes.
Who would be the arbiter of that? Like how would you suggest somebody, is that also a conversation that an individual would have with their provider?
Yes, it would be.
Okay, thank you.
Yeah.
And just for completeness of answer on that question, if you had the J&J as your initial shot, then you qualify for a booster. Everyone who had a J&J as initial shot is qualified for a booster 2 months after the first dose. Isn't that correct?
Yes, sir.
Okay, Thank you. Kathy was asking a question that seemed to be targeted more to Moderna and Pfizer, and I just wanted to point that out.
Yeah, I appreciate that clarification. Thanks, Mayor.
Sure. Councilmember Alter?
Good morning. Continue to be pleased with our efforts here and join my colleagues in thanking all of the folks who are out there day in, day out. I wanted to dive a little bit deeper into sort of the preparations for holidays and the recommendations. The data you presented suggested that letting up on masking, might lead to more of a spike. What are the recommendations if you're going to be with a group that's all vaccinated indoors? I'm not talking like a 50-person group or something, but like a 6 to 10-person group. If everyone is vaccinated, with respect to masking, obviously if people are out and about, they can always be exposed. But I just wanted to get some greater clarity on those recommendations if we ought to be masking even in those small groups.
If you're in a small group with people that you regularly associate with and they're all vaccinated, asymptomatic, and they have not had any high-risk exposures, you probably are just fine to have that gathering without masking. If it's outdoors, it's even safer. So any opportunity that presents itself where people can be outside gathering, that is a much safer choice.
Okay, thank you.
Thank you.
Thank you. And again, I'll just reiterate everybody, the city and county staffs are doing just a great job of driving down the numbers of unvaccinated. I think it's a really good idea to be focusing, as you are, on the people who've been vaccinated one time, because those are obviously people that have shown a willingness to participate. So that makes real good sense to me, and I like seeing that. I think the question a lot of people in the community are asking goes to what Allison and others, Councilmember Alter and others were asking, which is kind of this ambiguous place we're in, where our numbers now are 7-day moving average at 15, which is close to another break point on the chart to start thinking about. And I hear what you're saying is that the safest thing is for people to continue wearing masking when they can, because that's just safer to do. But yet we know there are a lot of places where that's not happening, and with the infectivity positivity level going down to 4.7, there are a lot of indications that are leading people to relax, and there's really a lot of environments where that happened. But all we have to do is take a look at what's happening in the United Kingdom to England to be reminded of how this is cyclical, and we're approaching another period, at the end of December, where if historical patterns follow each other, we could be looking at another cycle. And it's our job to keep that as low as we possibly can. The best way to do that is with vaccinations, which is why we continue to push on that. Your advice that it is always safer for everyone in the room if people are wearing masks is correct and good advice. And I recognize that people will be making all kind of individual decisions. But thank you for the work that you're all doing. Without any other questions, I'll turn it back to the county judge.
Thank you very much, Mayor, and thank you everybody for working together on getting through this. And I guess we will go ahead and adjourn now and for till 10:40. Does that work, Commissioner Trevelyan?
10:40.
10:45. Okay, we'll go to 10:45.
Yeah, exactly.
I'm shocked and dismayed.
Bye, y'all. Thank you. And Mayor, I'll pass it to you to do the thing.
Sounds good, colleagues. We're done for today collectively, so we're going to adjourn this meeting now at 10:25.
All right. Thank y'all very much.
Thanks, everybody. Stay safe.